Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call. Today, guest host Shelley Hearn, director of the Lerner Center for Public Health Advocacy, speaks with former EPA leader and inaugural White House National Climate Advisor Gina McCarthy about how climate change is one of the biggest public health crises of our time, and how important it is to acknowledge not only that every individual will face its direct impacts, but would also benefit significantly from actions to address climate change. Let's listen.
Gina McCarthy, I am so happy to be talking with you. If there was going to be a Hall of Fame for the champions on who's been protecting our climate, who's been protecting our health, you're my first nomination. I can't thank you enough for spending a little time with us.
Well, it's great to be here with you, Shelley. And I think you just mean I'm old. That's about all I'm amounts to.
No, you are one wise woman, and that's why we're tapping you. Look, public health has never been more challenged. It's not just the pandemic. We are fighting on so many fronts with opioid misuse, gun violence, obesity, of a long track record, and tobacco control that just continues with many, many issues. And now our leading scientific journal, The Lancet's coming out and has recognized that climate is one of the biggest public health crises of our time. So I'm turning to you as someone who has long been in the environmental field and a public health champion. Can you give us a little bit of your perspective on why public health needs to be involved on the climate crisis right at a time when they're dealing with so much?
Shelley, I'm happy to do that because you're right. I've always described myself as a public health person. That's never changed. I grew up at a time in the 60s and the 70s when it was very clear the damage that the environmental pollution was having on individuals. And climate is just sort of one step beyond that. It's basically, essentially, the most significant existential challenge of our time. And if you think about existential, it means people. It means we have the ability, if we don't tackle climate, to actually destroy our planet. And the only way that I've learned in my sort of long time in working in the environment and public health field is that people, for some reason, think the environment is one thing and public health is distinctly different. And then there's this thing called climate. There is a throughput to those things. And the fact is that the challenges that we're seeing on climate change are directly relevant to people's lives. And the reason why you want to grab onto public health is because it is the best way to do a few things. One is to make people recognize that climate change isn't a planetary problem. The planet doesn't give a damn if there's human beings or bugs and critters here. It only cares about itself. The only thing that makes it relevant is when you talk to people about what it means to them. And I've been doing work trying to make change in reducing pollution and addressing climate change. And the biggest motivator for change is public health. Look, if I can't make an argument that your family is better off if we address climate change, then we have failed miserably to explain to people that both the environmental exposures and climate are related to one another, and both of them has direct impact on their lives and the lives and health and well-being of their children. Now, that's what motivates change. And if we can then move on to say that all the things we need to do to correct these environmental problems and to correct climate change are essentially within our grasp today if we act on them. And that will mean better health, better stability for your children, better jobs, better economic input and activity in the United States of America, then we can then move at a pace and a breadth that environmental exposures and climate change demand. So it's just, we're at a huge moment in time. But honestly, Shelley, it's taken us, an exorbitant amount of time to make people really get that public health matters when you're talking about environment and when you're talking about climate change. It is all the same conversation, just at different scales and through different lenses. But the answers remain the same.
Yeah, it's really helpful to hear your perspective. And I do want to tap that you have been doing this. This is a positive, Gina. You've been doing this work for decades, and you've been making a difference for decades and seeing where public health can be part of that equation of success. And I'd love to hear, can you talk about where in some of the work in the past, you've been at the state level, federal level, you've run EPA, you've seen it all. Where did public health step in and make you go, hallelujah, they're here, we're going to win this one?
Yeah, I'll give it a try because, it's been apparent to me that public health is a motivator of change for a long time since I started. My first real job in this area was right after graduate school when I became the first health agent in the town of Canton. And that's when it was like in your face. I was there trying to figure out all the creative approaches to how we could deal with these environmental challenges we're facing. And then, all of a sudden you realize that people just have sewage flowing out their backyard and they don't like it and their neighbors don't either. So you got to take care of that problem. Okay, well, that is a fundamental public health challenge that we had. But then I found that I wanted to do something about basically the industries in town and how they stored their hazardous materials, because they had problems before with releases into the ground or air emissions. And what I found then was that the best way to address this issue, because everyone's going, why do you want to deal with this issue, blah, 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 blah. And I finally figured out that if I explained to them that if there's a fire in a building where you have hazardous materials, then that fire could actually prompt huge challenges in the surrounding community for air pollution and challenges for really toxic air pollution. And it could threaten the fire department and all of the people responding to it. That's when a light went on in people's eyes. And when I went to pass a hazardous materials bylaw in a town meeting, the fire department was there lining the walls because then it became personal to them. And that passed without a single vote against, because I started out talking wonky and I ended up talking real. And that was a lesson that I have continued to pursue, is how do we make every one of these challenges that we see real and relevant? And really the strongest motivator remains public health. It's when you connect it with your individuals and with your families and how better off they're going to be if we tackle these challenges. It became huge. But Shelley, it's never really been easy to get the public health community to engage in issues like the environment and public health. They're the ones that have been the most difficult to engage and activate, like the medical profession. And it took a long time to really get them to understand that they had a huge role here and they had to start playing it. And it's only really within the past 10 years or so that we've seen any breakthroughs in that. And it's really amazing because public health is everything. It is the biggest motivator of change in human lives.
Well, I appreciate your point of, facts matter, but putting a human face to these issues can make it real and can be the change agent. But, in this day and age where facts seem to matter less and less, maybe you could give some insights on how have you stayed so persistent over all these years of some very tough fights for better health protections. You know, we've been fighting on COVID and a lot of the pushback. And what I've seen in the public health world, I get more and more questions from professionals saying, how do we stay out of politics? How do we keep politics out of public health? And my push has been just the opposite. We need to be learning how to effectively engage. And that is something that the environmental community has done far better than the broader public health community. How would you pass on that insight, that lesson of we need to lean in rather than run back?
I feel exactly the same way that you do, Shelley, about the sort of early on lack of responsiveness to the sort of outcries for challenges that we were seeing that were environmentally induced or climate induced. It's just the healthcare industry as a whole saw themselves as the response to the public health problem. They didn't so see themselves as a primary way of interjecting the kind of prevention instead of the cure. And so there's been a real challenge with that. And I realized it early on, but it came at a head at EPA. You know, I was the assistant administrator in the air program where air pollution is a directly relevant effort to both public health, but in particular, environmental justice. I mean, you could see it and feel it. And when I became EPA administrator, the first thing I did was to tell everybody that EPA is an environmental agency, but we are primarily a public health agency. And you should have seen the look on their faces. It was if, well, why are we diminishing ourselves that way? I'm like, no, you don't get it. If we don't start talking about in a way that's totally relevant to human beings and do it in a way that relates to human beings and what allows them to engage and get excited and become hopeful, public health is it. And so we had long discussions about this. And now you can see that that's all changed. People are talking about the health impacts right up front. They're using that to engage people and get them to really motivate the change that we need to keep one another healthy as well as our climate safer. And that's the way that it's changed. But it was a long haul. And I'm not exactly sure why. I did some work at the Harvard School of Public Health in between heading to the White House and Natural Resources Defense Council, where I worked. And we spent, a lot of time trying to engage health professionals. I will tell you that nurses were the first to get involved in climate change and really heavily involved in environmental pollution issues. Now, we can argue about why that might be the case. I just happen to think that women tend to take on these issues more readily and more quickly and in a fearless way, and the nurses did. But trying to drag physicians into it, trying to get medical schools to start integrating climate as a consideration in what they do, trying to get physicians out there talking about the heat stress we're facing and what we need to do to address it, and getting hospitals to sort of be part of this game and understand that 8.5% of the U.S. greenhouse gas emissions are from the healthcare sector. Let's get on that because it could be impacting your patients in the hospital, doctors and physicians, but the broader community you live in. All those things have been hugely challenging. And I honestly think, Shelley, that it was just a segregation of issues. Medical schools don't teach about environmental exposures very much, and they certainly have never embraced teaching about climate change. Those things are gradually happening. So we do have a struggle. And one of the things we miss out is that physicians and nurses are some of the most trusted individuals in terms of giving a message to not just their patients, but the broader community. And when we can get them out speaking, it all of a sudden takes the big P politics out of it, and it puts the small p public into this. And so we just have to keep working with them. Times are changing, baby. We're seeing it happen in front of our eyes. Healthcare sector's waking up. Physicians are gathering. Medical schools are starting out to look at really updating their course structures and how to train physicians and the medical community better. So things are changing, but it's been a struggle.
Times are a-changing, Gina. And a quick sidebar, at Hopkins, we have now built advocacy to be one of the key pillars of the school's strategic plan. So we're the world's largest research operation, but it's no longer enough. We've recognized that our next generation of leaders have got to be skilled in how to engage and influence and translate the policymaking process with the strong bed of evidence. But here's why this conversation is so critical. You covered it. You're in the White House now. You've run EPA. You've seen it at the states level. You've been a champion on environmental justice. You headed up the country's largest environmental organization, the Natural Resources Defense Council. So you've been an advocate from many different lenses, inside government, at a non-governmental organization, an advocacy group, and you've been in the academic environment. So as we are part of giving the heart and substance to our next generation of public health leaders on how to be an effective advocate, what do you want to whisper into their ears?
I think they have to speak from the heart. It's about relating to people and passing on information. I think one of the things that we've struggled with mightily in the climate space has been the fact that a lot of the communication has been driven by the scientific community, and the driver that they thought was best was to scare the hell out of people. You know what I mean? We got to make this real and let people know that the world is on fire, blah, blah, blah. Well, that's not untrue, but it's also the worst way to motivate people to act. You know, so you have to relate to people. You have to talk to them what it means, not for the planet, but for them. But you also have to give them that ray of hope that, of course, we're facing an extraordinarily difficult problem. But if we want people to act and act quickly, we've got to motivate them, and we've got to tell them that there's hope. We have got to tell them that we have opportunities today to address climate in ways that we've never had before. And those technologies are going to produce opportunities that are good for them, that are cheaper for them, that will save them money, that will open up jobs. We need people to want change, not to be afraid if they don't change. Because what happens is that people just stand still. And so what I really want people to understand is that when they're talking to people and when they're trying to engage and be an advocate, the numbers don't matter. You know, you don't have to sit there and memorize the numbers. You need to sit there and relate to the people that you're talking to, one-on-one. Don't tell me about how many degrees centigrade we are at and how we talk to me about the challenges that they see. Talk to people and me about what we can do about it, and tell me that if I join in the effort to actually take action on climate, then I can save the people in this world. And I can give my children the kind of future that I want them to cherish and have. And so I do think, you know, getting rid of science lingo and getting rid of worrying about the numbers and the details is so important when you're talking to people. You just got to relate. Tell them what it means to you and what it might mean to them. And get them excited about the future, not afraid of it.
Gina, you're giving me hope, but you're also passing on these words of wisdom to the next generation of advocacy leaders in public health. And thank you for the work you have done, the work you're going to do, and we are going to be jumping in full tilt on working on climate, protecting health, and I can't thank you enough for your insights and time.
Thanks, Shelley. You're terrific. It was great to be with you.
Thank you, Gina.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.